Hello, welcome everyone. Thank you for joining us. I see our numbers growing and people pouring in from the waiting room. Welcome, welcome. Thank you so much for joining us today. I'm going to hold on a few seconds while our platform's letting everyone in. In the meantime, you are more than welcome to use the chat to say hello. Let us know where you're tuning in from today, and we'll be started in just a minute here. Hello, hello, welcome. Oh, wonderful. Thank you for letting us know where you're tuning in from. Hi, everyone. We're just going to give it a few minutes while our platform lets everyone in, but feel free to let us know where you're tuning in from today and give us a greeting. We would love to hear from you. Oh, I love seeing those coming in. Perfect. Well, welcome everyone. Thank you so much for joining us today. And welcome to today's webinar, Back to Basics, Understanding Mental Health Literacy. My name's Jackie Zimmerman, and I'm the Public Education Associate at Mental Health America's National Office. I'll be moderating today's webinar with you all. First, I'd love to say Happy Mental Health Awareness Month. This year, Mental Health America's mental health campaign is Back to Basics. This webinar is the first in our series, and you'll be receiving more information shortly about our next opportunity where you'll be available to learn more. We'll also encourage you to download our Back to Basics Toolkit, which I'll provide for you in the chat in just a little bit. I want to give you all a few notes before I introduce our presenter. This webinar today is being recorded and will be emailed out to all of you within 1 week. We do not offer CEUs currently, but if you would like a certificate of attendance, we have a form for you to request one. I'll also be posting that link in the chat, and it will come in the follow-up email as well. We've built in some time for Q&A at the end, so as we're going, feel free to put your questions in the chat, and we'll make sure to get to some of those with the time that allows. And also feel free to add any knowledge or comments in the chat throughout today's presentation as well. Our presenter today is Pierluigi Mancini. He is the president of the Multicultural Developmental Institute. He is one of the most sought after national and international consultants and speakers about mental health and substance use disorders. His area of expertise include cultural and linguistic responsiveness, immigrant behavioral health, social and racial justice, health equity, and health disparities. In 1999, Dr. Mancini founded Georgia's only Latino behavioral health program, which serves the immigrant population by providing appropriate mental health and addiction treatment and prevention services in English, Spanish, and Portuguese. Nationally, he's provided expert content to clients at the local, state, and federal levels. Internationally, he's provided consulting in Mexico, Italy, Colombia, Cuba, and Kosovo. He recently led a project to train clinicians in Latin America who are taking care of over 4 million displaced Venezuelans in the region. He serves as the secretary and treasurer on the board of directors for Mental Health America, National, our Wellstar Atlanta Medical Center, the Georgia Council on Substance Abuse, and RI International. We are so excited to welcome our very accomplished presenter today, Dr. Mancini. I will let you take it over from here.
Thank you so much. Thank you for that wonderful, warm introduction. And hello, everybody. Thank you. Good afternoon. Thank you for making time out of your day to come join us for this very, very important topic. What I hope to, there we go. What we hope to accomplish over this 30, 40 minutes is to describe health literacy and the principles of health literacy. So we'll begin with that and then transition over to mental health literacy. I also want to touch on some of the cultural aspects and some of the issues that people from other cultures that speak other languages may be facing when trying to receive the messaging, and then give you some tips as to how you can do or what you can do in order for us to have a better experience as we outreach to different groups. I usually like to begin my presentations with this quote attributed to Nelson Mandela. If you talk to a man in a language he understands, that goes to his head. But if you talk to him in his language, that goes to his heart. And I think this can set the tone for the presentation. So mental health literacy is a construct that has arisen from the domain of health literacy. It must be understood in that context. So the development of health literacy was initially informed by observations that low functional literacy was associated with numerous poor health outcomes. But recently, we begin to understand why, in order to improve health outcome and decrease health inequities, we need to enhance the operation of health systems. We need the development of health policy. So now we're recognizing that it's necessary that we need to improve health outcomes. So in general health, we make great progress in addressing these issues. In the area of physical health, examples would include knowledge of use of a healthy diet or taking actions to prevent skin cancer. They tell us don't go in the sun. Having first aid skills and know how to look up health information in a library or in the internet. So great progress has been made to teach people about physical health. But the importance of health literacy in mental health has largely been ignored. Healthy People 2020 had defined health literacy as the degree to which individuals have the capacity to do four things: to obtain, process, understand basic information and services, to make appropriate decisions regarding their health. But Healthy People 2030 changed that, and it now defined it in two sections. They divided it into personal health literacy and organizational health literacy. So as you can see, personal is the degree to which individuals have the ability to find, understand, and use information and services. In organizational health literacy is the degree which organizations equitably enable individuals to find, understand, and use information and services to inform their decisions and actions for themselves and for others. So there is a big distinction among the two, and it was felt that we needed to separate them. So health literacy includes things like finding health information. So where do you find this health information? Do you understand it when a clinician gives you instructions for your treatment plan or even simple tasks? Are you able to understand it? Are you able to evaluate it? Are you able to repeat it to someone in the same context that it was given to you? And then most importantly, are you able to use it? Can you act on it? So then if we have that, I challenge you, who is responsible for having good literacy? Is it the client? Is it the healthcare provider? Is it the healthcare system? Well, I say it's all of them. And what is the end result? You know, at the end of health literacy, what do we want people to do? So we want people to be able to find information. We want them to be able to understand it, evaluate it, and be able to repeat it. But most importantly, we want people to take action on it. Even people with the strong health literacy skills can face challenges. So for example, if they're not familiar with medical terms. Now, as adults, even as educated adults, and you'll see in a moment, I'm going to break it down for you, sometimes we feel shy of asking a fellow healthcare professional to explain something they just said about our health. So we decide not to. So we may not be familiar with medical terms. We may not be able to interpret numbers from our blood test. And we're not able to understand what a diagnosis is, especially if it's a serious condition. And the complex conditions that require complicated self-care. We also have different tasks of how we try and measure health literacy. So clinical can be filling out a form, an intake form, or the medical history form that sometimes they make us take several times. In prevention is following the guidelines for age-appropriate preventive health services. and then how to navigate the healthcare system. This is difficult even for people who work in the field, right? So we try and use those. But here's a basic structure. So I'm going to start this by laying a foundation about literacy, especially health literacy. So there's 4 levels that are broadly used in the space of health literacy. Someone that's proficient can use a table, calculate a share of health insurance costs for a year. They are pretty savvy, knowing how to understand the financial part of health literacy, the clinical part, the preventive part, all of it. An intermediate individual is someone that can read instructions on a prescription label. They can determine the time the person can take the medication. And then you have basic and below basic. So basic health literacy is someone that can read a pamphlet. Maybe they can give you 2 reasons why a person with no symptoms should be tested for some illness. So they have some kind of ability to process. And then below basic is someone that can read a set of short instructions and identify maybe what's permissible to drink before a medical test. So if they tell you to fast before you come in, they'd be able to understand what that means, right? So if we lay this foundation, I'm going to show you several charts pretty quickly to see where we are in the United States in general health literacy. So we have adult health literacy. Only 12% of US adults identified as having proficient health literacy. Only 12%. More than a third of adults were in basic. And below basic, 47 million basic, 30 million below basic. The majority of adults, 53%, had intermediate skills. When you look at this information by racial and ethnic groups, health literacy is an issue for all racial and ethnic groups. Now, this chart shows that all racial ethnic groups contain adults who were at below basic or basic levels of health literacy, but the rates vary, as you can see. The whites had the lowest share, 28% of adults at these levels, followed by the other category. And the other category included Asians, Native Americans, and multiracial adults. That's followed by Blacks or African Americans, and finally Hispanics, who have the largest share, 65%, at basic or below basic. We also have lower health literacy associated by education. It varies directly with levels of education. So over 3/4 of adults with less than a high school education were at the below basic level or at basic. 3/4. And it decreased dramatically as their education level increased. Now, while health literacy increased with higher educational attainment, 44% of high school graduates and 12% of college graduates had below basic or basic health literacy. It also, by age, the elderly have lower health literacy. Adults 65 or older were more likely to have below basic or basic health literacy levels than those under 65. Now, here's our challenge. If we know these for health, general, primary care, health literacy that everyone is supposed to know something about, imagine what would happen if we measured this for mental health. And finally, by type of health insurance. So the study also measured adults without insurance or those who are on Medicaid or Medicare had the lowest health literacy levels. Uninsured adults were more likely to be at below basic or basic. And 1/4 of those with employment-based health insurance were in the below basic or basic health literacy. Now, let's transition to mental health literacy. Keep an eye on my time here. So the construct of mental health literacy arising from health literacy is evolving. So we're starting to put a lot more focus on mental health literacy. Originally, mental health literacy was conceptualized as knowledge and beliefs about mental disorders to aid the recognition, management, or prevention. Later, that definition has been refined to include knowledge that benefits the mental health of the person. So what is it? What is mental health literacy? So one definition, there are several, but it has been defined as the knowledge and beliefs people have about mental health conditions which helps in the recognition, management, or prevention. It's important because it influences when and how people seek help and mental health outcomes. So it's not simply a matter of having knowledge. Rather, it's a knowledge that is linked to the possibility of action to benefit our own mental health or that of others. At the end of the day, we want to make sure that we put that information into practice. Mental health literacy also consists of several components, and these were created to overcome growing obstacles to mental health and address social stigma and prejudice. So they include the ability to recognize specific disorders or different types of psychological distress. Now, this is a big problem because in general population, people throw out words like crazy or they have a mental illness, and there's no specificity. And many times the person did not have a mental illness. They're just going by what media feeds us. But also the knowledge and beliefs about risk factors and causes. So we want to make sure that the components to overcome these obstacles includes beliefs about risk factor and causes, knowledge and beliefs about self-help interventions, about professional help that's available, even though that's been really challenging these last 2 years. Many people left the field. Clinicians who are practicing are booked up. You know, I personally had a personal friend of mine reach out and said, Pierluigi, please, I need to see someone. I mean, I was calling in favors all over the place. And they said, I'm sorry, I cannot take someone. It's going to be at least 3 months. So that's created a big issue. Attitudes that facilitate recognition and appropriate help seeking. You know, when people try to tell us something, you know, we're able to recognize if it's their limited ability to tell us what the problem is or our limited ability to understand it. And then how do you find mental health information? Now, luckily, more and more, you know, we have places like Mental Health America National, who I love, Mental Health Coalition. There's several places out there that are beginning to put more and more information out to the public so people can be educated about these issues. So we also need to make sure that we include information about substance use disorder or substance abuse challenges, because a lot of times both of them are included, or the person may be suffering for both. And we have to make sure that that information is also part of our toolkit. Lack of mental health literacy may cause poor health knowledge, poor health status, higher mortality, increased hospital use, increased emergency department use, and lower use of preventive services. So when we don't have this information, we suffer, and those around us that need our help suffer. So if we talk a little bit about culture, just a brief overview, transitioning into what are the foundations of the cultural barriers that we may encounter when someone is trying to learn about mental health literacy. So a person's culture influences his or her health beliefs, indirect or indirectly. Directly, each culture has their own beliefs about how illness is defined, about how certain illnesses are caused, and about the substances or behaviors that will help cure certain problems. Now, we are a multicultural country. We have people from many nationalities. We have people from many different health beliefs, religions, and each one of those have their own conception as to what culture, about what health literacy can be. Culture influences also how people communicate, how they manifest their symptoms, how they cope, People may misinterpret those behaviors. But it also influences the willingness to seek treatment and how the family and community can support it. So in many cultures, mental health is not talked about. Well, the general culture, many people don't talk about it, don't want to talk about it. But in some cultures, there's not even the word mental health or mental illness. So that's how far it goes. It's also, culture is personal. It's deeply rooted. Includes your environment, your thoughts, values, beliefs, your feelings, your sensations. And culture is always dynamic and it's always changing. You know, we get that from our environment growing up. You know, how we express ourselves. You know, we mirror kind of what we saw. We receive things in different ways depending on who we are, how safe we feel, and where we come from, and our past experiences. That's what makes our culture so important. I'll give you an example. When I took a girlfriend to meet my parents, and my family is Italian and Colombian. So I took him to meet my Italian father and my Colombian mother. After a few minutes of us being in their home, she pulled me aside and said, honey, why are you guys fighting? And I explained to her that our elevated voice and our hand movements were not signs of fightings. This is how our family communicates. For us, this was warm, and this was a way that we express ourselves. So we need to make sure that we understand these issues. If you want to give it a definition, we can use this one, integrated pattern of human behavior, thoughts, communication, actions, customs, beliefs, values. But it's also typically defined and described as the totality of learned behaviors. So what this means is that culture provides us with our identity. It's a learned as part of our natural process growing up in family and community. I also want to highlight what is not. So you cannot say culture is a personality. You know, culture is not static. Culture does change and adapts. Culture is not the language a person speaks or the ethnic or racial group they belong to or identify with, and it's not related to geography. Sometimes we confuse characteristics that are not part of the individual's culture with their cultural identity. And that's what we need to also recognize what culture is not. So how does culture affect an intervention? In this case, health literacy. So one way is by understanding the influence of culture on behavioral health services. So over the past 20 years, I have dedicated myself to working with immigrant and refugee groups and working on linguistic access. And part of what I've learned is that the intervention gets affected depending on how the clients communicate, how they manifest their symptoms, how they cope with stress, how they interact with their families, and also what they're willing to do if they do recognize a problem. I also wanted to put a little bit of cultural literacy. I'm going to tie this all together, don't worry. So cultural literacy is the ability to converse fluently in the idioms, allusions, and informal content that creates and constitutes a dominant culture. So that includes things like being familiar with street signs, like if people tell you, you know, the Chrysler Building in the United States, you may know that's in New York, or, you know, the Grand Canyon. So you're familiar with certain things in the general dominant culture. But cultural literacy also stresses the knowledge of pieces of information that individuals assume you as a provider or you as a peer already know if you're trying to help someone different from you. If we don't have mental health literacy and cultural literacy, we're going to leave a lot of people out. I'll give you a brief example, and this is a true story. A Spanish-speaking client that had limited English proficiency was prescribed a medication. The provider wrote the order as usual. In this case, it was take once per day. But the provider failed to recognize that in Spanish, The letters that make up once, ONCE, actually means 11. And the client ended up taking 11 pills instead of the one per day as prescribed. So we need to make sure that we have cultural literacy as part of this process. And now, 19 years later, we still recognize that mental health systems has not kept pace with diverse needs of racial and ethnic minorities. And then systems neglect to incorporate respect or understanding for histories, traditions, beliefs. And misunderstandings and misinterpreting can lead to tragic consequences. Now, we've known this and some progress has been made, but we still have a lot of work to do. And then another report, and this was 1999, I believe, is striking disparities in mental health services for racial and ethnic minority populations. This still rings true. I wrote a paper yesterday and I was quoting 2017 reports that still had this information: less likely to have access, less likely to receive, less poor service and quality care, and underrepresented in research. So 22 years later, we still have this. Now, if we don't come up with a proper way to address cultural literacy, we end up with misdiagnosis, unnecessary hospitalizations, misinterpretation. And misinterpretation, sometimes the mistake we make is that we take it as non-compliance. Said, oh, they just don't want to get better. We also see a lot of people no-show if they don't have that understanding, and it leads to more doctor's visits, wasted appointments. So I want to briefly also tell you about this study, studying literacy and misunderstanding about prescription labels, similar to the example I gave you. But in this one, 385 patients, 19% with low literacy levels, 29% with marginal, and 52% with adequate. And the homework was to read 5 prescription bottles. So participants who read at least 1 prescription bottle incorrectly, 63% were in the low literacy level, 51% marginal, and 38% adequate. So even at adequate, you had 38% of people that couldn't read a label. For another test, the question was, show me how many pills you would take in one day. If the instructions are, take 2 tablets twice daily. So most of us can do mental math and said, okay, the correct answer is 4 tablets. But you see on the screen, the folks with low literacy levels correctly stated 4 tablets, but then they couldn't count, they couldn't separate it. So only 71% stated it correctly, but 35% were able to actually demonstrate it. And then it increases with marginal and adequate. But you still see that there is a disconnect, even with something as simple as how the prescriptions are written today. A brief word about language is often the primary language to individuals accessing information. And the language competency includes the degree to which the person providing the information is actually fluent in that other language. And fluency has 4 areas: read, write, speak, and comprehend. And sometimes we forget about that one. So linguistic responsiveness is the teaching practice that support learning, development, and engagement. And the Department of Education actually has a much faster take on this. And that's why the example is about children. But in healthcare, we can say that linguistic responsiveness is the capacity of an organization and its personnel to communicate effectively and convey the information in a manner that's easily understood by diverse audiences. So let's get to some of that. Here's an example. Oh, great, the book is in cow. Laughter helps. Brief definitions. Sometimes we misuse translation and interpreting. So this is more of a pet peeve that I try to throw in. But translation is when you're working with written text. You translate a brochure. And interpreting is the spoken message. So you hire an interpreter that's going to sit next to you to talk to a provider. Again, that's more of a pet peeve. But here are some things about ensuring language access, then we'll move to literacy in outreach. So quick questions. Do you know the language needs of your community? Do you have a communication and language assistance plan, actually something in writing? How do you know the client's preferred language? And do you train your staff in language services or interpreting? And how do you let your clients know that there are language assistance services? You know, another quick question is, do you know the top 5 languages other than English that are spoken in the United States? And if you look that up, you'll be surprised. So let's talk about outreach. So effective communication is a critical part of promoting mental, emotional, and behavioral health and preventing behavioral health disorders. Now, successful outreach, for us to be able to do this, it depends on how we engage and how we motivate the people we're trying to reach. Sources of information, adults with below basic or basic health literacy. So they reported that they get a lot of information from radio. And healthcare providers. Healthcare providers came up very high. So they do trust a doctor, right? Or a nurse. Family or friends. And that's very common with immigrant and refugees, usually family and friends. Some from newspapers, brochures, magazines. Internet is last, right? So most of us today are used to going up in the internet, but a lot of people with low literacy levels don't know how to do that. Even though many of them, 84%, we did a small study in my clinic, 84% of clients had smartphones, but many didn't know how to use them. So here's some brief outreach strategies. You need to start with the planning process. What is your goal? You need to identify your audience and work to understand them. How do they consume information? Every service area is different. So you can use some commercial marketing strategies, and I hate to say it, but really bad, horrible crisis in this country, like tobacco and opioids, those people had great marketing strategies to reach their consumer. So using commercial marketing strategies can also help us get there. We just have to put it to good use. So tactics include a planning process, beginning with setting goals and objectives, identifying the audiences, and defining and talking with those audiences to determine the most effective way to reach them. Now, one sidebar. If you're sending someone to talk to a community, it's always better if they represent that community, whether it's the deaf community, the LGBTQ plus community, an immigrant or refugee community. People tend to be accepted better if the information is coming from someone they identify with. And then some of the tactics include grassroots outreach, media relations. Public service announcements work great. In my clinic, we did 3 public service announcements in English and in Spanish, and they reached a lot of people. And then relying on thorough and a specific audience information allows practitioners to speak the language of that group. Now, a proper cultural, linguistically responsive agency does view different groups as distinct and as having different subgroups. They hire employees that reflect that their base. They consult with minority communities. Before we implemented any program for outreach, any brochure, we had community group meetings. We met, and in my clinic, we used to serve Spanish speakers and Portuguese speakers and English speakers also. So we would have focus groups with these communities, and they would teach us what's the best way to approach you. And we were highly successful. They need to decide what they're capable of providing to the minority clients. A lot of organizations today are struggling with finding that language contact, but they exist within those communities. You need to go search and find for that hero. Support policies that enhance your services, and that's from the top down. You need the buy-in from your leadership, governance, in order to do this, and your workforce. you need to make sure that you have the right workforce. Now, I want to show you this video. It's a brief video that we're not that different. And I'm going to stop sharing because I'll have to share again and add the sound. Otherwise, it wasn't going to be working. So let me share screen again, share sound. Hold on, I'm going to have to go here first, close that.
And as we're pulling the video up, I'll just remind everyone that we do have some time at the end for Q&A. So please feel free to post any questions for Dr. Mancini in the chat, and we'll be going through some of those as well.
Thank you. All right, so let's go and watch this video. And hopefully the sound will work for everybody. Let's get this thing out of here.
I'm proud to be English. My family have served and we've defended this country and we've been to war for this country.
I'm really patriotic about Bangladesh.
Well, I am 100% Icelandic, yeah, definitely.
This is a Kurdish wedding with my mom in the traditional Kurdish clothes.
We're just proud black, so that's it.
Yeah, I think we are probably the best country in the world, if I'm honest.
Think about other countries and other nationalities in the world. Are there any that you don't feel you get on with well, or you won't like particularly?
Germany. Yeah, I'm not a fan of the Germans.
You might think they're a little bit.
Particularly India and Pakistan, probably because of the whole, the conflict.
Because I have this side of me that's like, that hates Turkish people. Not people, but the government.
But French?
No.
We're just best, it's just fact.
I'm more important than you. I don't know you, but in my opinion, I am strong and I am more important than a lot of people.
How would you feel about taking a journey based on your DNA?
Yeah, I feel very intrigued.
What could you possibly tell me that I don't know?
So do you know how DNA works? So you get half from mum and half from dad, so 50% from each of them, and they get 50% from their parents, and back and back and back. And all those little bits of your ancestor, they filter down to make you, you. I need you to spit in this tube for me. You spit up to the little black line.
That's a lot of spit.
Right, the story of you is in that tube. What's it gonna tell me?
It's gonna be, oh yeah, you're French, and wait, your grandparents are French, and wait.
100% Bengali.
Solid Iraqi. I'm Cuban.
You're gonna tell me that I'm English, like I've told you.
Jay, you come down and join us?
I'm a little bit nervous, I have to say.
So you ready to find out your results? Will you read it out to us, please?
Wow, look at me.
Oh my God. Oh, wow. Shit, I didn't expect that.
All of them.
Whoa! No.
Caucasus, which was Turkish?
Yeah.
Eastern Europe, Spain, Portugal, Italy, Greece.
I'm 32% British.
What?
Great Britain, 30%. Can we 5% German?
I'm Irish.
Yeah.
So I'm a Muslim Jew.
Great Britain, 11%. Are you sure these results are mine?
Eastern Europe? Seriously?
Iceland has definitely moved closer to Europe now.
I'm gonna go a bit far right now, but this should be compulsory. There would be no such thing as extremism in the world if people knew their heritage like that. Who would be stupid enough to think of such thing as a pure race?
in a way, we're all kind of cousins in a broad sense. In a much more direct sense, you have a cousin in this room. Turn around and guess who it is. Waj?
Yeah. What's that?
Why don't you come down here and meet your cousin?
God, this is amazing.
Did you know that?
I didn't know I did. This is like, my heart's pounding right now, I swear to God. We met.
Jay from everywhere by the reason is.
I'm a real man of the world.
Wow, that's beautiful. Thank you.
So would you like to travel to all of these places?
Yeah.
Oh, yeah.
So thank you so much for your time. That is all that I have for you. So I'll stop share right now. And hopefully you have some great questions for the last 15 minutes. Thank you. I'm reading the comments. It is powerful, you know, and it comes, I love using that video because it makes us aware of our own humanity, and it makes us think about, if the person in front of me ended up being related to me, would I be treating them differently? And why wouldn't I do the same for anyone that was standing in front of me, right? So we need to think that way. Okay, Jackie, any questions?
Yeah. First of all, thank you so much, Pierluigi. We appreciate all of the knowledge that you've been able to share with us in this time. I will get started with a few of the questions we have coming in. We have one question that says, do you think the amount of people who struggle with health literacy and mental health literacy also says something about how these systems should be more straightforward than they are? Of course, we are wanting to promote health literacy and mental health literacy for consumers, but should we consider rethinking our healthcare systems in some ways in order to better meet people where they're at?
That is an excellent question, Jackie. Thank you. So you're absolutely correct. We have a reactive health system. Most of our efforts have been placed historically in taking care of the crises, right? Taking care of the problem. And until the last couple of years that we started seeing more about prevention and promotion that hadn't existed before. So yes, the system needs an overhaul. The systems need to start putting emphasis on what we can prevent and what we can avoid. Think about if in elementary school, you were taught about your emotions or begin to be demonstrated how to express your emotions in a healthy way, what difference that would have made in our lives. So if we begin at an early age, we can help educate this new generation on how to properly manage their emotions, and that's gonna help a lot of people avoid negative parts in their history. Good question.
Yeah, definitely. Thank you so much for that answer. Another question that's coming in, and I've seen a few people asking about different resources and just knowing your background. Are there other resources you know talking about mental health that might be in other languages that people can access?
So good question. And I want to talk a little bit about language because of what I mentioned earlier. Just because someone speaks another language does not make them culturally responsive in that language. It may not even make them fully bilingual or fluent. So before we run out and start asking people who we know who speak another language to translate or develop information for us in another language, we need to make sure that they are competent and that they are fluent. So there are places where you can go. So on one of my sites, eldoctormancini.com, I have a lot of Spanish language information. The bulk of it is still COVID, but I'm starting to transition back to information about substance abuse prevention, substance use challenges, mental health, in English and in Spanish. So there are places where you can find that. Mental Health America has Spanish language assessments. You can have several of the assessments on the Mental Health America website or in Spanish. And there's more and more organizations that are beginning to properly either translate or develop materials in Spanish. NAMI, yes, that's right. NAMI also has materials in Spanish. Thank you so much. I know that they would be upset if I didn't mention that. I work with them.
Yes, yeah, there are some great resources out there. And a few other comments and questions I've seen coming in kind of throughout today, and also again is the nuance of language and communication, and that they're not always, you know, there's differences in each, and how do we maybe communicate with someone that doesn't have the same language, or how do we better communicate even if someone does speak the same language but there's cultural differences?
Excellent question as well. So what I recommend to people is when you want to communicate with someone that speaks another language, or a whole community in your service area, there's always someone in that community that is concerned about the mental well-being of the community. I call them the heroes. And you just need to do some homework. You need to start getting to know people in that community. Many of them will be bilingual, so not everyone is going to speak a different language, but learn from them. For example, lately, you know, we were just getting used to receiving Afghan and Iraqi refugees who speak Arabic, and now we're starting and then we started receiving unaccompanied children from Central and South America, and they didn't speak English. And now we're getting individuals from Ukraine, and all of those had very traumatic experiences, right? So if we don't know how to directly approach them, then we need to find someone in that community that can guide us, that can hold our hand, and they can be that bridge. Now, you know, personally and a little bit selfishly, once I find those folks, I try to recruit them to come work in the mental health field, because we need bilingual, bicultural people in the field. And I've been successful. There's been a couple that ended up going back to school and they're clinicians now. So we need more than that.
Yeah, definitely. Thank you so much. Another question we just had come in is, what is the biggest gap for most organizations, organizational health literacy?
Organizational what?
Health literacy.
Health literacy. Ooh, okay. So you're uncovering one of my most passionate areas. When we talk about organization, okay, we need to make sure we start with ourselves, personally, individually. Have I done the work that I need to do in order to walk into this environment? And by that, I mean, have I looked at myself? Have I looked at my own culture? Have I looked at my behaviors, how they may come across to another member of another community? Have I studied whether I have implicit biases that I'm not aware of? And we all have bias and prejudice. It's based on our environment. But have I done that homework, right? So once I start with myself, and then I'm going to approach my organization, it needs to be from the top down. There's nothing more frustrating than having the boots on the ground folks be completely trained and competent, and they know exactly what they need to do. And they take their great ideas to leadership only to get shut down. Why? Because there was no buy-in. And the reality is that to do this appropriately, organizations need to have it as a budget item, because it doesn't get done for free. If you get people to translate items for you for free, you're going to get what you get paid for, what you paid for, right? You're going to get poorly translated materials that are going to further isolate those communities, because the message will be, you don't know me. You don't know who I am. You're giving me information that's poorly written or even erroneous in some ways. You know, I was called many years ago here in Atlanta. An organization said, Pierluigi, can you come help us? We really don't know what happened. We have a large Mexican community in our service area. We planned this huge event on a Saturday. We had food, we had kids games, and it was a Cinco de Mayo event. And we thought a lot of people were gonna come and we're gonna give them information. And we printed this big banner that said, come celebrate Mexican Independence Day, Cinco de Mayo. Well, what's wrong with that? Mexican Independence Day is in September. It's not in Cinco de Mayo. So the community just said, they don't know me. Nobody showed up, right? So we have to be purposeful about this.
Yes, thank you for that. We had another question come in. Are you aware of a baseline measure that has been used to look at mental health literacy?
What I was able to find was about physical general health literacy. I think if we have any young, vibrant students in the audience, and maybe you need a project for your master's or your doctorate, I think this will be a very wonderful opportunity for us to look at mental health literacy and how we can continue to move it forward. Now, the good news is that we've seen how good it works in general physical health, right? Like I mentioned, we know to wear sunscreen. We know not to stay out in the sun too long. We're going to avoid skin cancer, right? We know how to read a label. I mean, when food labels came out, nobody knew. Now we know. We know what calories are. We know what, even though I still don't know what yellow number 2 and blue number 5, I don't know what those things are. But, you know, at least we're reading the labels. So we know that we've made progress in physical general health, even wearing seat belts. All those were transformationally grassroots community movements that made sense. Now we need that revolution in mental health literacy.
Yes, definitely. We had another come through that says, where do we start when wellness, health, and illness, whether physical, mental, or emotional, are used interchangeably?
And by that, I'm assuming you're referring to mental wellness, mental health, and mental illness.
Yeah.
I know that there's been movement lately to focus on wellness. And I actually, and personal bias, but I actually love the Mental Health Coalition. For those of you that are not familiar with it, Mental Health Coalition is a Kenneth Cole, the designer, has a coalition where they big presence in social media. And they developed a roadmap, and I really love the roadmap because the roadmap is beginning to use words like mental fitness. So just to add another one to it. And the way they describe mental illness, because they do separate mental health, mental illness, mental well-being, and mental fitness. Mental health, they see it as an umbrella term. Everything from daily mood to severe mental distress in a continuum, and 100% of people have mental health every day. Now, mental illness is a clinical term. So that's a specific condition, impacts mood, thinking, behavior. Mental well-being is a strengths-based term. It kind of gives you the opportunity to fall right in, and it can exist at the same time as mental illness. It describes a sense of emotional and cognitive wellness. And it makes you feel like you belong, like you have a connection. But the new term I love from them is mental fitness. It's a new evolving term. Taking care of your mental health. It's an action word. Purposeful practice, and includes mindfulness, physical exercise, self-care, and important during times of wellness and illness. And then The other part that I like in what they talk about is they move another continuum of being in crisis to struggling to surviving to thriving and finally to excelling. And we want to get to excelling because I want to excel. I want to be happy. I want to enjoy every single minute of every single day. I shouldn't be able to have to suffer any more than I need to.
Yes, thank you so much for all of that. And it just fits right in with what we are trying to communicate this month with our mental health awareness campaign of getting back to the basics of what are those things, and that mental health is something that we all have, we all experience, and not using it synonymously with mental illness, but also understanding that mental illness is something that a lot of Americans and people across the world encounter every day. And so I love that new mental fitness, and talking about there's things that we can do to help our mental health, just like with our physical health. I will go to a question. I love this one.
Before you give me that one, I want to make sure people noticed the comment you made that we do have the Back to Basics. We have the Mental Health America Toolkit in Spanish. So someone had asked, where can I get more information? Right here, Mental Health America or mhanational.org.
Yes.
Okay,
And
what question do you have?
that's good. I'll make sure in our follow-up email too, we send where you can request for both the English and the Spanish versions of that. So you'll have that link. Our other question is from someone who says, I'm working on a project that intends to help community-based organizations in my area raise their health literacy. Is there anything you wish you could say to teams like mine that we should keep in mind when doing this kind of work?
I love that question. And first of all, thank you. Thank you for getting out there in the weeds and getting to know community-based organizations that do carry way above and beyond their load in order to help. And to raise health literacy, again, so one thing we have going for us, every city, every county, every state, they have their annual health outcomes, they have their health disparities. So this is information that's easily found. So once you're able to identify what's going on in your community, then you have not only a target audience who lives in your community, but then you have specific issues that people are targeting. So, becoming educated as to what's going on in your community is going to buy you a lot of goodwill, because if you go in there offering solutions, it's going to open doors that otherwise wouldn't be open. So what I would recommend to teams like yours, keep in mind when you're doing this kind of work, again, getting in the community, finding that hero in your community that can open doors for you. And if that community has sectors or large parts of it that are different from you, culturally, racially, ethnically, linguistically, then have someone in your team that mirrors, that belongs, that can actually provide that bridge for those communities. Another thing I recommend, if you're collecting information from the community, make sure the community is involved in developing the materials, the questions, the questionnaires, and then that people who are from the community are the ones that are asking the questions. We've had a lot of success in doing that, making sure that the community helps us write the instruments, and then that the community help us collect the information.
Yes, thank you so much. We have one last question we will get to quickly before we end our time here. It says, I teach an undergraduate class on images of both mental illness in film. Both mental health literacy and stigma reduction are themes. What do you think is the link between stigma and mental health literacy?
Yeah, that's a beautiful question. I made a brief comment on the when I addressed this, that we respond to images we see in film and TV, and we use words like, oh, that person is crazy, because that's all we hear. So the link between stigma and literacy is huge. I think is the lack of mental health literacy, especially in media, film, radio, newspapers, with social media. They need to be educated about mental health literacy. They need to stop using words like crazy, or they need to stop associating whatever crisis happens with someone who had a mental illness, because most of the time that is not true. So I applaud you for doing that work. And I noticed sometimes when I go to movies, or rarely, or if I watch a show on Amazon or Hulu, that people are still doing that. They're still using words that are not proper, they're not correct, and they actually do more damage than good. So we need to continue to educate those fields.
Yes, definitely. Thank you so much. We will wrap up there. I know we're just at our time. Thank you so much, Dr. Mancini, for everything you've shared. So much value came out of the last hour together. And we just want to say thank you to everyone who joined us here, and for all of your great questions and comments in the chat, and seeing the work that you're doing in this area is so inspiring. We'll be in touch with everyone in the next few days with the follow-up materials and the link to request your certificate of attendance, along with a recording, and the slides will be available too. So thank you everyone so much. Have a wonderful rest of your week. And thank you, Dr. Mancini.
Thank you, Jackie. And please feel free to include my email when you send the information to the attendees. Happy to work with any of you.
Perfect. Thank you so much, everyone. Have a great day.
Bye, everyone.